Hi everyone, my name is Madeline, and I will be talking about debate 1 today, which is that given the recent COVID-19 outbreak, the Trump administration should or should not withdraw funding from the World Health Organization. And I will be arguing that the Trump administration should not withdraw funding from the World Health Organization. So I want to begin by just giving a brief overview of the issue, and so I want to start by talking about what the World Health Organization is. I'm actually a global health major along with political science, and so I've done a lot of work with the World Health Organization and epidemics and pandemics. And so the World Health Organization is a specialized agency of the United Nations targeted at global health. It's really regarded amongst experts as being the premier global health organization in the world. It's only rivaled possibly by the Bill and Melinda Gates Foundation, which, as it sounds, is Bill Gates and his wife Melinda. They're a philanthropic organization and they do a lot of work in the global health sector. So according to the World Health Organization's website, their goal is to build a, quote, better, healthier future for people all over the world. And so they work to combat both communicable and non-communicable diseases, as well as other health-related issues such as environmental issues, sanitation, access to clean water, nutrition, access to medication and vaccinations, and maternal and child health issues. So I also feel like it's worth noting that the U.S. is the largest donor to the World Health Organization, so we play a really critical role in the function of the WHO. So why is the Trump administration withdrawing funding? The Trump administration gave notice that effective July 6, 2021, the United States will withdraw funding from the World Health Organization, and this is based mostly on criticisms of the Chinese government. So the Trump administration alleges that the Chinese government misinformed the organization of the true threat of coronavirus, and then subsequently that the World Health Organization has been too supportive and positive towards the Chinese government in light of this. So I want to begin my argument just by stating that there's really actually very little evidence that the Chinese government hid evidence about COVID from the WHO. There's some controversy in the beginning with the government of Wuhan trying to keep early reports of the virus under wraps, and I'm in no way condoning this behavior, but the reality is that it very quickly became too big to hide, and that the global response time lost because of this is actually really inconsequential in the grand scheme of things. And so even once the world knew about the virus, it was still controversial early on whether or not it was going to become a global issue, to no fault of either the Chinese government or the World Health Organization. So most public health experts view the Trump administration's criticisms of the WHO as an attempt to deflect from the U.S. government's poor handling of the pandemic. So just a brief overview of the situation of COVID in the U.S. comparatively speaking. The U.S. leads the world in total cases with almost 4 million cases. It leads the world in coronavirus deaths with almost 150,000. It's behind almost every other Western developed country with the exception of France and Sweden in testing. So the best way to look at testing is to look at the percentage of positive tests that a country is getting back. And so looking at the sheer number of tests can be misleading because this will obviously vary based on the population of the country. So Johns Hopkins recommends that the maximum percentage of positive tests be around 5% to ensure that enough tests are being run. And so the US is currently between 6 and 8%, which is obviously above that threshold of where we want to be with testing, and like I said, is behind most every other developed Western country. It is worth noting that data for testing in China is not currently available, but their total cases are only around 86,000 with about 4,600 deaths. And I don't have the time to get into the accuracy of China's numbers or their reporting issues, but like we're going to talk about, this is largely irrelevant. So I find it helpful to look at a timeline of the early situation with the COVID pandemic. So it started on December 31st. The WHO picked up reports of what we now know to be COVID-19 in Wuhan, China. By January 3rd, Chinese officials were cooperating and providing data to the WHO. By January 9th, The Chinese authorities discovered that the cases were caused by novel coronavirus, which we now know as COVID-19. January 10th, the World Health Organization recognizes the need for global preparedness plan, and it publishes a comprehensive package of guidance for countries covering the management of a potential outbreak, including information on infection prevention and control, testing, travel guidance, clinical management, and a whole host of other things. You can look those up on the WHO's website. It's worth noting that by nature, regardless of whether it's being issued by an international organization like the WHO or a local government, any information about a novel disease is going to develop over time. It's going to be changing because we just don't know. By mid-January, there was evidence of human-to-human transmission, in some cases reported in the WHO European region. A small note for clarity, with novel zoonoses, which are diseases that are spread from animals to humans, like COVID-19, it's not always initially known if the disease can spread from human to human. Viruses undergo stages of mutation and adaptation. Oftentimes, when they're first reported in humans, they have the capability to jump from animal to human, but not from one human to another, which is why some die out fairly quickly. A good example of this is Ebola. Ebola can jump fairly easily from animals to humans, but it can't sustain itself for a long time in human populations. That's why it flares up and dies down relatively quickly. But others can sustain themselves in human populations for extended periods of time, like we're seeing with COVID. So this is really important to acknowledge, because when it comes to novel viruses, it's very difficult for anyone to know the specifics or what exactly the disease is going to look like over time. Like I said, the situation is by nature going to be developing. So there is evidence from other coronaviruses that we've been working on, such as SARS, but it's already pretty clear that SARS and COVID-19 have some pretty significant differences in terms of transmission. So on January 27th, the Trump administration began daily task force meetings to address COVID. By early February, we were already having concerns over the testing capacity in the U.S., and this was when there was only a handful of cases in the U.S., so there's already concerns about our testing. On February 2nd, Trump issues the first of several travel bans, and it's really worth noting here that travel bans are widely regarded as being ineffective at preventing the spread of disease by public health officials, even with COVID. There's been some research done on travel bans issued in China, the spread of the disease, and really you're looking at travel bans buying you a matter of maybe days, a couple days, which is not a lot in terms of increasing preparedness. So they really are not that effective. In a globalized world that we live in today, the disease is going to spread, it's going to find a way in. And so skipping ahead a little bit, March 11th, 2020, the World Health Organization declares the coronavirus outbreak a pandemic. So that's a very bare bones timeline of the early situation, but it's enough to give the general idea. So while China's mass quarantines and control measures have been controversial and also are not replicable in most countries due to differences in regimes and whatnot, most experts agree that they bought the rest of the world several weeks to respond by limiting the spread. And the reality is most countries, including the U.S., largely floundered this time. The U.S. wasted it trying and failing to design its own COVID test. And this is really important because this specifically shows not the failure of the WHO, but actually the U.S.'s failure to engage with the WHO in a productive and meaningful way. So it's not widely known here, but the WHO actually formed a database of test designs contributed by other countries that were known to be effective and known to work, that were available to all countries for free. So while we were floundering time that we had to respond and build up a response plan and testing capabilities, we were wasting it trying to develop a test that ultimately was very ineffective and wasted weeks once the virus was in the country, when we had a database of test designs available to us for free that we chose not to use. We really don't know why we chose not to use them, but we didn't. We chose to make our own. And so this is really just the first in a very long line of guidance that the WHO provided that the US failed to heed. The only meaningful national action that the US has taken really on a national scale has been travel bans, which again, as I talked about earlier, are largely considered to be very ineffective. There's been no national lockdowns, no national social distancing, requirements. There's been guidelines issued, obviously, by the CDC and the White House, which are oftentimes conflicting, but it's been largely up to states to determine how they want to respond. So I think this makes it pretty clear that Trump's issues with the WHO are mostly just scapegoating his own failure to respond to the pandemic. There are some valid criticisms of the World Health Organization's response to COVID, and these largely center around the fact that the organization has been slow to respond to the need for new and updated guidance. And this is valid, and it's also understandable that a large bureaucratic organization would have difficulty keeping up with a situation that's changing as rapidly as the COVID pandemic is. But this is evidence of room for improvement, not complete failure. In fact, there's significant research that shows that the World Health Organization's response to past pandemics, such as SARS, have been highly effective. And so, really, I think this is evidence of room for growth, but it's not a complete failure on the part of the World Health Organization. It's also worth noting that while this may be the most popular issue in the media, this is far from all that the World Health Organization does. They engage in a wide range of health-related activities and have greatly contributed to improving health around the world. And so this is not to say that the organization is perfect. It clearly has problems that need to be ironed out. In fact, I think it's really important to analyze ongoing responses of international organizations in order to improve them. But it's clear that most of the criticism from the WHO in regards to COVID-19 is not based on fact and is far from justifying revoking critical funding from an organization that has done a lot of good around the world. In fact, I think this is more reflective of Trump's overall view that the U.S. should withdraw from international organizations, which, as I've just pointed out, is not entirely justified in this case. And in fact, the World Health Organization has been shown to do a lot of good and also probably could have helped the U.S. had we been more involved with them during the pandemic. So thanks for watching. Bye.